This is a 2-year-old boy with the presentation of burning micturition, and cries a lot when he micturates. So while placing the probe in the subcostal region and then angling it downwards to get the urinary bladder, what I am seeing is, you also share with me, there is now this is the urinary bladder in transverse section, and here you are seeing a dense coarse echogenic area measuring approximately 8.2 millimeters, and which is the calculus in the lumen of the urinary bladder. And the reason why this child is crying while he micturates. And now along with this calculus, you see there is a debris within the urinary bladder that is layered out with the posterior wall, which can be bleed or pus. These are the echoes. This is debris that is layered out with the posterior wall of the urinary bladder. This is the urinary bladder, anterior wall, lateral wall, and this is the posterior wall of the urinary bladder, in which you see echogenic area settle down, which is debris, can be pus, can be bleed. However, the bladder wall is normal. It measures not more than 1.3 millimeters, so no evidence of cystitis. Debris is seen settle down with the posterior wall of the urinary bladder in transverse section. Now remember, behind the posterior wall of the urinary bladder you will be seeing this sort of an echogenic area, echogenic in the center, hypoechoic at the periphery. That will be a bowel, not to be confused with the otolium. So this is the, now let's do the same with the transverse section. Pressing the probe longitudinally and trying to get the total length of the urinary bladder. This is the total length of the urinary bladder. You see, here I am in the longitudinal section, and in longitudinal section, manipulating the probe just like this, and share with me what I am seeing. There you see, this is the calculus. It gives posterior shadow. This is the posterior shadowing.
Cepat. No. Coba tarik.
Now, as the child will relax, go further in the further study. Now this is the urinary bladder in longitudinal section. This is the calculus within the lumen of the urinary bladder, and this is the posterior shadowing from it, and this echogenic area represents the debris that you were seeing in transverse section of the in the transverse section. Now let's have a glimpse of the this is the kidney. This is the right kidney measuring. This is a large view. kidney measures 6.2 centimeters in length and 2.5 centimeters in anterior. This is the right kidney. There is no calculus seen. There is no significant hydronephrosis. This is the left kidney. And remember that in you will this is the left kidney. This is the left kidney. Remember that it measures 5.9 centimeters in length and 2.9 centimeters in anterior posterior diameter. Now the important thing to note is that in kids you will always see that the central sinus echo complex will be present, but it will be rather muffled. Now this is the area of central sinus echo complex. It is present. The fat is seen, but is of not that dense as you see in the other kidney, and its amount is also less. Second thing that you will be seeing in kidney of a 2-year-old child will be that the pyramids will stand quite prominent. See, this is the medullary pyramid, this is the medullary pyramid, this is the pyramid, this is the pyramid. So the pyramids will stand quite prominent. So this is a normal kidney. Thank you.